This is the continuation of the report. Second step, team meeting. It is the responsibility of an administrator to call for team meeting, arrange for the physical space of the meeting, set the team agenda, and notify all prospective participants. The team meets with the main objectives of reviewing the referral, clarifying the problem, and determine the next step of the process. So, in the explanation of the second step, as an administrator or leader, you initiate the meeting by notifying team members of the time, date, and purpose of the meeting. Arrange the physical space. Ensure that the meeting space is suitable for the number of participants and conducive to productive discussion. This may involve booking a conference room or setting up a virtual space. Third step, formal assessment. If the student performance remains below than what is expected, even when modification of the program have been made, the team may refer the student to be assessed to determine if the child has disability and requires special education services. At this time, formal assessment of the student takes place. So, informal assessment po typically involves conducting a structured evaluation or analysis of the situation or problem discussed during the team meeting. Gather relevant information or evidence related of the issue under consideration. When formal assessment is done, the following standards are considered. A written notice is given all parents and guardians. The primary purpose of the written notice is to ensure that parents and guardians are aware of important developments of events concerning the children's education. Number 2. Parents must give written permission to the team allowing them to evaluate their children. Written permission ensure that the parents are fully informed about the evaluation process and understand its purpose, procedure, potential benefits, and any risk involved. During evaluation, the team may use a combination or standard test, observation, interviews, checklist, and other assessment or gather the information about the child's abilities. For letter A, there should be a variety of assessment, tools, and strategy to gather relevant functional and developmental information. This include information given by the parent that assist determining whether the child has a disability or to determine an educational program cited for child. For letter B, do not use any single procedure as the sole criterion or for identifying whether a child has a disability or to determine an educational program suited for the child. For the letter C, use technically sound instrument that will properly accurate, assess, and the relevant information contribution of cognitive, behavioral, physical, and development factors to the disability of the child.